Alright students, we are going to conclude our lecture on schizophrenia with segment 3 on treatment. Slide 32. The main form of treatment for schizophrenia is medications. That is the primary form of treatment. Right now there are basically two generations of antipsychotic medications. We're going to talk about the first generation first, and then a little bit later on we'll talk about the second generation. First generation antipsychotic medications were introduced in the 1950s. Basically they're neuroleptics, things like phenothiazines or thorazine. Basically, after a person has an acute episode, the individual then is put on a maintenance level or maintenance doses to prevent relapse. We do know the drugs are fairly effective at doing things like reducing agitation, violent behaviors. They act by blocking dopamine receptors. However, they've had little or no effect on negative symptoms. It's important to keep in mind that these medications are not a cure. What they are really meant to do is to prevent another acute attack of schizophrenia. And the drugs, for many individuals, have some serious side effects. These side effects include things like sedation, dizziness, sexual dysfunction. When we look at some of the more serious physiological side effects, they can include tardive dyskinesia. Tardive dyskinesia includes involuntary movement of the lips, tongue, and mouth, things like tongue thrusting, and it impacts about 10 to 20% of individuals who take these first generation antipsychotic medications. There's also neuroleptic malignant syndrome. It impacts about 1% of individuals that take these meds, where they have severe muscle rigidity that can lead to a coma or can lead to death. But as I said before, really what happens with these medications is that individuals are given maintenance dosages or maintenance levels to prevent a relapse or prevent another acute phase. About 30% of individuals have no alleviation of symptoms. In other words, they're taking the medication, about a third of them don't get better. About half of them quit after a year because the side effects are so distasteful. And about 3/4 quit after 2 years because of the unpleasant side effects. Slide 33. The second generation antipsychotics include things like clozapine. These medications also impact serotonin receptors. There seems to be fewer motor side effects, less treatment noncompliance, and it seems to reduce relapse. But there are still side effects to these second generation antipsychotics, and these side effects include things like impairing the immune system, functioning, seizures, dizziness, fatigue, drooling, weight gain. They do seem to be better at improving cognitive function and improving the cognitive problems that seem to go hand in hand with schizophrenia. And they do seem to be moderately better at treating the negative symptoms. But the research is still unclear as to whether or not these medications are actually an improvement. Slide 34. So here in this table we have the first generation drugs listed and the second generation drugs listed out for you. Slide 35. And when we try to answer that question of clinical effectiveness, there was a study done called the Clinical Antipsychotic Trials of Intervention Effectiveness, the CATIE study, that specifically looked at these second generation drugs. And they found that second generation drugs were not more effective than the older first generation drugs. The second generation drugs did not produce fewer unpleasant side effects, and still nearly 3/4 stopped taking the medication before their study even ended. The biggest concern was that the second generation antipsychotics seem to have much more serious side effects. Things like weight gain, diabetes, and pancreatitis. Pancreatitis is inflammation and infection of the pancreas. The other interesting trend that research has pointed out to is that for people of color, they were not prescribed second-generation antipsychotics. They were almost always prescribed first-generation antipsychotics. Slide 36. When we look at psychological treatments or psychological intervention, psychological treatments are almost always combined with medication. The patient outcomes research team report, they recommend medication plus psychosocial intervention. When we talk about psychosocial intervention, we're almost always talking about social skills training. In other words, you're teaching skills for managing interpersonal situations, things like going to work, reading bus schedules, grocery shopping, making appointments, basically day-to-day life. Involves lots of role playing, other practice exercises, both in group and in life. Other psychological treatments include family therapy to reduce expressed emotion. As I lectured earlier, families that have a high level of conflict or a high level of expressed emotion have a tendency to see higher levels of relapse. And these programs, these family therapy programs, have a tendency to want to educate families about the causes, symptoms, and signs of relapse, the stress, the importance of medication, making sure that individual takes their medication and stays on their medication, helps the family to avoid blaming the patient, improving communication, improving problem solving, expanding support, and instilling hope that things will get better. Slide 38. Other forms of psychological treatment include cognitive behavioral therapy, recognizing and challenging those delusional beliefs, recognizing and challenging the expectations or feelings that are connected with the negative symptoms, cognitive remediation training or cognitive enhancement therapy, improving attention, working to improve attention, memory, problem solving. With schizophrenics, we do see a lot of case management. In other words, it's a multidisciplinary team providing comprehensive services. Really what we're talking about here is having a psychiatrist work with a counselor or clinician working with a social worker, making sure that person gets all the support that they need. And finally, residential treatment, vocational rehab for that individual, helping them to try to get reintroduced into society.